Hello, this is Ask Dr. Ben. All right, next question, another leftover from last week. I got a little bogged down when we got to Friday. Finally came up with a good idea. I don't know, we'll see if it works, but more about that later if it works. If not, whatever. Yeah. Okay, so next question is from Di. The question is, I know we're now learning this isn't just a respiratory illness and it's attacking more of the body. Yeah, mostly the virus is respiratory and a bit what we would call enteric, like in the intestines. But the immune response to the virus in particular can hit all kinds of parts of the body because it's really strong and it can go toward multiple organ failure, such as the strength of the immune response. A lot of this doesn't seem to be directly caused by virus, although in some people who have died, like with the extreme cases, you can find traces of virus in other parts of the body. But mostly it just stays in those two parts, lung, throat, all that which is connected, lung, throat, nose, and intestine. Yeah, so there we go. But that's not the point. The point is I have a son with one kidney. Yeah, okay, yeah. We just found out that he was born without one. Yeah, that's... I haven't heard of it, but I don't. Yeah, I don't follow this part of science. That's very peculiar. Yeah, yeah. All right. Yeah. I guess he was already special to you. That makes him even more special, right? Let's see. And we only just learned this, and he's 8. That's a different conversation. Yeah. How would you know? Yeah. I've never counted any of my internal organs. Yeah. There are probably people walking around there in exactly the same shape, and they just don't know it. I just couldn't tell you how many there are. I know there's another condition where all your organs end up kind of left-right swapped. It's a thing that happens in development, and as far as I understand, you can be fine, but I forget, it was 1 in 300 or something like that, but it's more common than you'd think. Yeah. Okay. I've been concerned about him, but not as much since I've been thinking this is more a respiratory illness, but now I've been reading about chronic kidney disease, yes, as a possible thing that can happen and lead to death. Yeah, interesting. So, I think what you're reading is correct. I think that, so we know that there are receptors in the kidney, and it looks like the virus should be able to infect, but nobody's shown that it does infect. So it doesn't look like it's a direct thing, at least in the 99% of the patients, sort of the big part. So it's probably not going to directly infect the kidney, but if it did, then yeah, that would be a very serious complication in your son's case. From what I gather, that would be the logical thing. Yeah, of course, this is not medical advice as always. Yeah, because I'm not a doctor, not that kind of doctor. Is my son at risk because he has one kidney, and how does it play into this? And should I be extra concerned? It's one of these cases where he's going to be at risk if he catches the virus, and he's not particularly going to be at risk otherwise. It's like a risk of further complications. I would look at it as just another reason to be careful, but there are more and more reasons to be careful every day. In fact, the hotel where I'm staying so that I can be here to try and do some work has actually taken away all the coffee machines that were downstairs today. And yeah, before, when you had them out, there were people that would just come down there and sit, like normal, no mask, whatever, having a chat. Yeah. Which, I don't know, a couple months from now, maybe, but right now, it's just not a great look. So, there is kidney damage. It's mostly caused by the immune response to the virus rather than the virus directly. And in the case where you're already going to be at effectively, you've got one kidney doing the job of 2, any degradation of the function of that kidney would be more noticeable. So this is something, now that you know it, there are things that a doctor would be able to do. This should be one of the first things that you say, should it ever happen that somebody in your family becomes infected, including your son. This is what they'll need to know, and then they'll be able to at least do their best from there. But this knowledge is very, very useful in this case, and I'm glad you know. That really helps. So all the best to you and your whole family. I just hope you guys all stay safe through all of this, and Thanks very much. This has been Ask Dr. Ben.